Right, so we are speaking about therapy works, and with me on set this morning I have Amanda Locke and Robyn Edwards, and this is a running segment that we are going to have for a few more weeks, maybe about 3 more weeks, and we are speaking about therapy and the different areas of therapy that are available in Trinidad and Tobago and how it could help those who are affected. So this morning we are speaking about speech and language pathology, and as I said, this morning with me are these 2 ladies who will tell us more information. So Robyn, why would a child need speech therapy if they're already able to speak?
Well, speech therapy, I think, as much as that's what we're called, it almost underrepresents what we're trained in and what we actually do. There's so much more to it. Basically, as a speech and language therapist, you break it down into a few areas. The first is speech. That includes articulation. So that includes people that maybe have a lisp or can't say an R sound properly. It also includes stuttering, people who stutter, as well as people who have voice problems. Voice problems include people who have like a hoarse or rough sounding vocal quality. And then we move on to the language side of things. Language is broken down into receptive language, which is how much we understand, what we're able to comprehend, and expressive language, which is how much we're able to get out, express. It's also a third facet to language is pragmatic language, which is social communication. As humans, we're very social creatures, yeah? Yeah. So being able to use language in a way that we read, interpret, and can respond to the social cues and social situations around us is an essential part of language use, yeah? Yeah. We're actually going to talk to you more about this in another segment, social thinking.
Good. Yeah, because again, we're being social right now, we're communicating and we're chatting, and there's the part where you listen and then we formulate and we respond.
The part where you understand and then the part where you express, yeah?
Exactly. So Amanda, do speech therapists work only with children, or are there other clients who can benefit from your type of therapy?
Well, as Robyn just expressed, our scope of practice is very, very big, but a lot of the things that Robyn just mentioned can actually apply to adults as well. So whether it be that someone had a stutter or an articulation problem as a child that never got remediated, they could come to us as an adult client. In other cases, it's something that presents later in life. So having a voice problem may be the result of being a professional voice user, a singer, someone, a pastor, someone who uses their voice on a regular basis. They might have issues with the voice quality. Or it could be something, the result of an accident after a stroke, if there's any kind of brain damage to the area of the brain where language is kept. Right. Someone might have difficulties expressing themselves, someone might have difficulties understanding, or it could be as simple as just having more difficulty finding words. So adult clients are often, someone who has had some kind of brain trauma. And then less commonly known, one of the things that speech pathologists work with is actually swallowing disorders. So again, after trauma or maybe after head and neck cancer, anything that could disrupt the coordination of all of this musculature here, someone could be at risk for having swallow safety issues.
I've never really thought about that before.
Yeah, so that's a very important part of what we do, because if you're not swallowing safely, it puts your lung health at risk, and essentially you could be at risk for aspiration pneumonia. So we would help try and find the safest way to help someone eat and drink after a stroke or brain injury.
Wow, that's a wide range of clientele. How do all these people find out about you, speech therapists?
So there are a few different ways. The best way is we get most of our referrals through pediatricians or other doctors. But also we get referrals through psychologists. Schools are huge. Teachers, kindergarten teachers, they are like our first line of defense. They see our kids at the earliest stage. And then really, we live in an internet age. We live in a world where people can Google things and find stuff out on the internet. So we get a lot of parents coming to us because they have done the research and found that it's needed.
So if I wanted to, I could have gone on www.findaspeechtherapist.com, for instance. I don't know.
In theory.
Yeah.
Amanda, so what kind of things would indicate that someone, a loved one, a child, an adult, needs speech therapy?
Well, it's good to consider what the developmental milestones of a child. So for example, by their first birthday, we want them using a couple words here and there. By their second birthday, they should be putting words together into little 2-word sentences. You know, whether mom can understand you or not is one thing, but by the age of 4, a stranger should be able to understand everything, pretty much everything a child is saying. So in terms of children, you know, those are the typical developmental milestones, but then you also have the concerns of if a child is not interested in communicating, if they're not making eye contact, if they're not playing, if they're not smiling socially, those kind of things are a bit of a red flag for maybe having some kind of social communication disorder. And then you look at adults as well. So maybe someone hit their head and you didn't think it was a big deal, but suddenly they're having trouble finding their words. Or if after a stroke they're coughing a lot when they're eating and drinking, those kind of things could indicate the swallowing problems. So just little red flags here and there.
Yeah, a number of things, all right? So, okay, so like, it sounds like, okay, so let's put it into like real life, my world. So if my loved one needs speech therapy or another type of therapy, what do I do next?
So first I would contact your doctor, and then second, look us up. Therapy Works is on Google, on Facebook. There are also other speech therapists throughout the island that you can research on the SLAT, Speech Language Audiology Association of Trinidad and Tobago, if you're concerned about it.
Okay, well, again, thank you for being here this morning. Amanda Locke and Robyn Edwards, both speech language pathologists. And as I said, this is a regular segment we'll have for about 3 more weeks about the different areas of therapy and how it can affect those, how it can help those who are affected by various maybe disabilities and all like that. All right, so Trinidad and Tobago, we have so much more in our show ahead. We'll be right back with much more. Stay with us.